The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the First Surgical Clinic of the General University Hospital. Therapeutic positions for patients. When positioning a patient, we use assistive devices that help maintain the desired posture to prevent pressure ulcers. These devices are washable and are stored in cabinets within the department. Therapeutic positions play a significant role in the overall treatment process. Some hospital beds are equipped with a lateral tilt function, allowing side-to-side positioning using a remote control. This function enhances the prevention of bed sores and reduces the physical strain on staff when handling patients. Position on the back, supine position. The supine position, or lying on the back, is typically the most tolerated position. However, positioning patients on their backs is not advisable due to the increased risk of pneumonia and bed sores in susceptible areas, which include the heels, the sacral bone, elbows, shoulders, the seventh cervical spine, and the top of the head. Side-lying position. It is the primary position we use for patients to prevent the formation of bed sores. The lower limbs are bent at the knees, the torso is perpendicular to the surface, and the head is aligned with proper support. The position prevents pressure sores in the sacral area. It allows for effective drainage of bronchopulmonary secretions. The ankle can be supported in a neutral position. Patients in this position are highly susceptible to pressure sores, which is why we utilize devices to prevent decubitus and monitor pressure areas more often. These particularly include the ankles and knees, including the inner sides, hip and the greater trochanter, elbows, shoulders, temples, ears and head. Semi-supine position. It is a position between side-lying and supine. The torso is rotated slightly backward and supported by a pillow along its entire length, ensuring that the lower shoulder is not compressed. Fowler's position. In this position, the patient has the upper body elevated through a support or an adjustable bed panel. This position optimizes lung ventilation. It is commonly used for patients with heart and lung conditions and those recovering from abdominal or thoracic surgery. A mild Fowler's position is at a 45-degree angle. A full Fowler's position is at a 90-degree angle. To prevent the patient from sliding down, a soft foam cylinder or rectangular support is placed under the feet. Due to gravitational pressure, the soles of the feet experience high pressure, so they must be regularly checked for pressure sores. The knees are bent and the head remains aligned with the spine. Orthopnic position. In this position, the patient is seated, with the upper limbs resting on a table, bed headboard, or supported by positioning devices. The lower limbs are relaxed and supported on the floor or a footrest. This limits venous return to the heart and the congested pulmonary circulation. Patients often assume this position outside the bed, sitting at a table or leaning against a chair. The orthopneic position facilitates the use of accessory respiratory muscles, making breathing easier for patients experiencing severe dyspnea, orthopnea. Preferred positions while seated: feet, thighs, coccyx and buttocks, the sacrum, scapulae, and thoracic vertebrae. Trendelenburg position. The patient lies on a flat surface with the head aligned with the spine. The bed is tilted at an angle of 15 to 30 degrees. The upper limbs are relaxed alongside the body. The lower limbs may be in slight flexion at the hip and knee joints. The foot should be maintained at a right angle. This position ensures better blood flow to the brain and circulation in the upper half of the body. It is commonly used in intensive care to ensure better access to central venous entries. This position, however, worsens lung ventilation, increases intracranial pressure, venous return to the heart, and central venous pressure. Reverse Trendelenburg position. This is the opposite of the previous position and is indicated for patients with arterial circulation issues in the lower limbs. Position between the hips and abdomen. This is a suitable position to relieve preferred contact areas for patients who tolerate it well. The bed is in a horizontal position and the patient lies on their stomach. The head is slightly supported and turned to one side. The chest may be supported by a pillow, while the abdomen and pelvis lie freely. One of the lower limbs may be slightly raised. A disadvantage of this position is the significant gravitational pressure on the cervical and lumbar spine. It can also cause breathing difficulty in patients with heart or respiratory issues. Pressure points in prone position. Dorsum of the feet and toes, the knees, frontal bone spines, back of the hand, elbows, shoulders, the face.